This is Dr. Meyer with another weekly video blog. Today I'd like to talk about weight management. This morning at the university we had a grand rounds on liver disease and obesity, and a lot of interesting things were brought up, and it's a common problem, and with over half of our country being overweight and a third of them being actually obese, it's a continuing problem. It's a problem we see daily in practice, and no matter what the serious medical problem is, I would say that half the patients coming in are talking about being overweight and please help me to lose weight. And women especially, when I have them get on the scales, they say, do I have to? And some of the women I have actually stand on the scale backwards. They don't want to see what they weigh, and some of them, after their weight, they throw the thing over so it's zero. They don't want anybody ever to see what they weigh, and so it's a very sensitive issue, and weight management is a really very difficult problem. I've been involved in that since I'm a pulmonary physician, and remember the old Pickwickian boy who was so fat he couldn't breathe, and then he just kind of went to sleep. And I had a Pickwickian once. He was sitting right here in the patient chair, and if I wasn't talking to him, he would just go right to sleep. And one time I had him in the hospital, and I suggested physical therapy to help limber him up and have him walk. The physical therapist came and evaluated him and says, this man cannot get out of bed. And so the point is, I went over to the patient's bed and told him, hey Jerry, let's wake up here. I got my knees against his knees and pulled him to an upright position. Once he's in an upright position, the physical therapist all around me couldn't believe the fact that he was walking. They couldn't even get him out of bed. And so the point is, people go to sleep because they can't breathe, and then they fall asleep, and so lung doctors frequently are involved in weight control in that situation. Another little sidelight on that, Pickwickian syndrome, they will eat anything in sight, and some people actually put a big belt around their refrigerator and chain it shut, because this guy would go into his refrigerator at night and he would just start on one shelf and just start eating everything, come back and forth on the other shelf, and his mother couldn't prevent that. But on the other hand, mothers went to see their children eat, and so she couldn't really bolt the refrigerator too good, you know, and he could always get in. So that's how we got involved in it, and we did some interesting things. I was in a county hospital, and so there's no day charge, so there's nobody gets charged a few $100s a day in those days, or $1,000 or $2,000 nowadays. And so we had people come in because we were doing the zero-calorie diet, and people thought that was wonderful. And so we had a lot of ladies that came in, and we put them on 0 calories. All they got was water and no calorie fluids and their vitamin pill. And they were happy as a lark, and they weren't hungry, and all of them lost 30 pounds over 30 days. And then when we see them in the clinic a month or two later, every one of them had regained the 30 pounds. So that wasn't effective either. And here a while back I had a patient. I normally don't use diet pills anymore, but there's a new one on the market recently, and the names keep coming up, and many of them are quite hazardous. And I had one lady, I consented, and so the diet pills basically make you a little nervous. They're like uppers, and so we don't like to give them more than 3 months out of the year. And so, and she was insisting on more diet pills after being off of it for a while, and I pulled the chart out and I just graphed it for her. You came in at 180 pounds, you thought you were overweight, and we got you down 20 pounds, and then when we started you on diet pills again, you're about 210, and then we started you on diet pills, you came down 20 or so, and then the next time you were ready for them, it was 240, and so I said, well, you know, we've done this now for several years now, and you're about 60, 70 pounds heavier now than we started. so the diet pills don't work. And she wouldn't believe that, and so she went off to find another doctor that would give her pills. We may have mentioned diet before. Just to remind you, there's several diet books that may be worthwhile. I particularly like the Pritikin diet. We met the Pritikin family here, and they've done some very good research, and they've basically eliminated heart disease and strokes from the people that really follow their rather severe low-fat diet. And I know of the old Mr. Pritikin, an engineer, got very concerned about that when he had heart disease, and they were trying to, I think, bypass him. And he says, no, I'll go home and I'll take care of this myself. And he developed a Pritikin diet program, and took care of his heart disease. And many years later, when his leukemia caught up with him, his last check on his coronaries revealed that they were soft and pliable, just like a baby's coronaries. He had eliminated all the hardening of the arteries in his body, all the hardening of the arteries around his heart, and he actually totally reversed his heart disease. And that's what we're about. And so, you know, we've got our cholesterol down from 220 down to 150, and get the blood pressure down. So I'm not really worried about ever having a heart attack. I think I'm in the same category as Mr. Pritikin. The other diet I like is the zone diet. Dr. Barry Sears wrote the book on the zone diet. This was brought to my attention by a nurse, and I got the tapes and went through those. And this is a very instructive diet. I really think the first 3 chapters is really all you need to change your dietary habits, and then follow through on that. And of course, Dr. Andrew Weil, the guru from Tucson Medical School, as the Optimum Health, and he's always good. He does his entire life on diets, health foods, and how to cook, and so on. So he has a number of books out, and he also has a newsletter you might want to subscribe to. One book I really like is Dr. Bob Schwartz. He was doing diets, and he was not overweight, but he got involved in the program, and so he watches people, and he put them on diet programs, and most of them, you know, they would be on it for a while, and they gain, and he went on diet himself. He found out he did the same thing. He went on a diet, he loses weight, and then he'd overeat, and then he gradually became fat over the years, and he tried many diets, and so he finally wrote a book. You know, I've lost 2,000 pounds over these 10 years, but I've gained 2,001. So I can assure you that diets don't work. I've tried over 100 of them, and it's a very interesting book and gets lots of good information. Later on, he tried to say, well, if everybody's gaining weight on these diets, then I should get skinny people. And that was very popular. He got a lot of recruits from thin people and put them on the diet, and they had to follow the rule book just like the obese people. And then they would lose weight and overeat, and before long they were gaining weight. And they were gaining weight from the same diets that other people were trying to lose weight. So he wrote the book, Diets Still Don't Work. One of the things that Dr. Schwartz mentioned is that how do basically or permanently thin people, naturally thin people, eat. And he found they only eat when they're hungry. And they quit eating when they no longer are hungry. And they enjoy every bite of food they eat, every bite they put in their mouth. And they stop eating when they're no longer hungry. And one of our other videos, I think we can say the same thing with water. People drink water and they have the water bottle with them at all times. But the people that don't go into heart failure from over-drinking are the ones who do the same thing. They only drink when they're thirsty, and they quit drinking when they're not thirsty, and they enjoy the freshness of the water, and they quit drinking when they're no longer thirsty. And so it's a very good rule to follow. One final comment from our medical grand rounds at the University of California Davis this morning was the visiting professor from Duke. She had a map of the United States there at the end. And it was interesting to me that the fattest state in the country was Mississippi. And the ones that followed there, Alabama and all the way North Carolina, South Carolina, were well, pushing for a #1 spot and being the most obese state in the country. Interesting to me was the leanest state in the country was Colorado. And the ones that were next to that were the people above it, Utah and Montana, were next to Colorado. And that's it for today. Don't forget to subscribe to my channel for new videos and post any questions you have in the comments section below. I'm Dr. Meyer. Until next time, take care.